Pairing live stream. Oh, episode two. I love beginnings. Let's see if we made it to live.
Being live stream. I got some little thing.
I think we got there. Yay! Notifications. That means we're official. Let me make sure it's public and people can see. I'm so excited to be here with you tonight for episode 2 of the State of Our Union. So before we get started, let me just make sure everyone can access it.
I just
How
saw
are you today?
I'm all right. I just looked up because I have my computer screen. I'm like, oh my goodness, I'm gonna be looking crazy sitting
You
there.
look great. Stop
No,
it.
looking crazy. Like when I look up at my screen, people are gonna be like, what is he doing?
Oh, no. You see, we're using multiple technology here. I have paper. I have a lot of different things, but we're going to get through tonight because we have so much to talk about. Thank you so much for being here to discuss it. There's a lot going on in our city. There's a lot that politically we should be getting involved in. So we're going to start in about 60 seconds. It was a beautiful weekend, though.
It was.
It wasn't as cold as I thought it was going to be.
Yeah, even with the exception of today with the freezing rain.
Yep. I was inside most of the day, I must say.
Yeah. I didn't experience that it was fully freezing rain until I got back home.
Yep.
And it was flipped in front of my house, but I didn't fall.
Hey, as long as you saved your back. The first fall of the winter is the worst. Okay, I believe I shared it in all the places that I needed to share it. Just triple checking. There we go. All right, I am so excited to get started tonight. It is officially episode 2 of the State of Our Union. My name is Tiffany Alicia. I am the founder and creative director of Real Recognized Faith, and this is our podcast created to strengthen the civic engagement of Springfield. And we're going to be doing that through a variety of conversations all year long about politics, about how to engage in your government, and breaking news that affects our day-to-day lives. We want to make sure that we're not just talking about politics when it's time to vote, right? We want to see how it intersects with our daily lives. So that's what we're doing. And it is officially episode 2. And I'm so grateful to have an amazing community leader with us tonight. His name is, let me get this right, Sherard, W.L. Johnson. When you got the initials, you're something special. And he has worked in both youth development and related to the mental health field for a very long time. And he also has an inspiring organization that we're going to be talking about tonight. But I'm going to let him jump right into it. So can you just tell us a little bit about yourself, please?
Wow. So that's like one of the biggest things that I have a tough time of doing, which is talking about myself. There are people that do know me, but they're like, yeah, right, he could talk about himself. No, it's actually tough. Oftentimes I have to be forced. So for those of you that don't know me, as she said, my name is Sherard W.L. Johnson. I have both my master's and bachelor's in social work through Westfield State University. I just wanted to clear up something on the flyer. Everyone saw LSW. So for my current job, I have to have a license. So at the time when I got my current job, the only thing I qualify for was a bachelor's level license, but I am going for my master level license, which is my LCSW soon. So that, the things on the end of my name will start to change.
That's another 4 letters, baby. Licensed clinical social worker. I am here for it. And thank you so much for the role that you play, because you guys are invaluable to our community. We need you every single day, so we appreciate it. You do
just
it
to throw out there, I am one of those people that do stuff behind the scenes, and I'm not used to publicizing what I do. Because I believe if you're doing something, you should always do it from the heart. You don't always have to publicize what you do to help
Yeah,
people in the community. So,
it is very true. You do it because it's who you are. That's amazing. Um, so yeah, before we jump right into all this different news about the Springfield area that we got to talk about, can you tell us a little bit about your organization, Renewed Vision
so
Mentoring?
yeah, so one of my biggest passions has always been youth, especially male youth, around the teenage years. One of the things that stuck out to me is having you. It's always tough to talk about, but working with youth that have an absent father, absent mother, or even a present parent that's absent. Um,
Oh, say that.
and a lot of times, a lot of the youth don't have a lot of people that they can trust and just be themselves and just talk to about what it is that they're really dealing with. A lot of times, a lot of and I'm going to put in quotes, mentors that are out there, is they do a lot of talking and not listening to the youth, because the youth will actually tell you what they need versus you feeling what the youth need to progress. And a lot of the behaviors the youth present is not necessarily, um, you know, them. It's
Right.
either a cry for help, or there's always a lot of underlying issues. So it's always trying to get to the root cause. So for the past, for a long time, I've worked with
Turn up.
youth, and it's always been my passion. Um, I was therapeutic mentor for various mental health agencies, and then I decided, to go back to school, get my bachelor's, and I
Mhm.
think it was my last semester of we had to actually do a business plan. And it's always been a passion of mine to have some type of mentoring program.
Mhm.
At that time, the name of the program was going to be From Boys to Men Mentoring, B2M.
I still love it.
And no, I know I sent you the original logo, and I have all the
Yes.
names, everything.
You
But
did that.
one of the things that I failed to do was look to see if the name was already copywritten. I
Yeah.
did Google it to see if it was out there. So this past year, I keep thinking we're in 2021, but we're in
Get out of
2022.
there. We ain't going back either.
So this past year, in 2022, I was pushed to still pursue it because I was getting discouraged while still helping youth. And I changed the name to Renewed Vision Mentoring. So that should be coming soon. The plan is already in place. You're, in the process of being completed.
Yep.
um, there's some other things we need to work on to make sure this name isn't taken away.
I love it. I love it.
So it's really to help youth that just really need the help, and that just want someone to just listen to them, and then when they ask for guidance, give them guidance.
Yeah.
Oh
And you know
no,
what?
I was
It,
private.
it's amazing. It's amazing that you simplify it that way, because let so many different industries tell it, whether it's education or health or so many different places, they struggle and say that the problem is so complex and it's insolvable in terms of supporting the spectrum of needs that our youth community has. But what you're saying is they're going to tell you what you need. You're having
Mm-hmm.
to listen, and you're going to have to navigate it on their terms. And that whole student-centered approach, the child-centered approach, I think we've moved away too far from that, and we need to find our way back to it.
Exactly. And, it also, goes back into the trust factor. Like, as an African American, like we grow up not really able to trust people, or we feel, therapy, which I know later on we're going to talk about mental
Yeah,
health.
we're going to talk
But
about it.
so I'm not going to get too deep into that now, but, don't go talk to somebody who don't relate or look like you. But one of my biggest issues, even in school, which I had a professor who confirmed what I said, is the mental health system wasn't designed for minorities. It was actually
Ooh,
designed for class white people. So
Oh
that's the
man.
reason why it's harder to relate to us, because it's a system that was never really designed for us. And they're just most recently starting to include us in the studies.
Are
So,
you sure you wanted to start at the top with that? Oh
so
man.
I'm just sorry. So that's one of my biggest things, is like me making sure that, you know, I look at the root cause, because I'm
Yes.
able to relate to what a lot of the youth are dealing with.
Well, I listen, you start coming out heavy hitting, and I appreciate it. And you are so right when you talk about the various minority communities, and especially when you put the socioeconomic status on it, the low income communities expounds that it wasn't meant for us and not for us to maintain. I've struggled. I've tried to go to therapy, and sometimes it worked. Other times I get cut off because policy changes and things shift. And it's just it's so difficult to maintain a healthy mental hygiene when the supports that our community needs are so complex to access and to consistently access. Just because you're in doesn't mean you're going to stay in the system either.
Mm-hmm.
So, but yeah, thank you for jumping right on into that. That is awesome. So this is the state of our union, I guess, where we get right to it. And we are going to go through our categories. And today, first off, we're going to go into the state of our union in regards to finances. And we're going to be talking about small business assistance. So I actually have a screen share I want to do really quickly, because I want you guys to also familiarize yourself with the sites and the resources that I'm talking about. So just give me 1 second and I will have that up. But yeah, when we talk about the small business community of Springfield, it is so exciting because there's just so much good going on. People are creating businesses every single day. They are expanding their businesses. They're getting storefronts. They're doing what they have to do to make sure that they are successful and they're able to complete their creative outlet. That being said, I want to make sure that our community realizes that there are so many resources out there for us to be successful. We briefly touched about mistrust in regards to mental health, but we kind of have mistrust everywhere, including in our financial literacy and what we think we have access to. So for today, in regards to finance, I want to make sure everyone knows about the Department of Planning and Economic Development in Springfield, Massachusetts. This department was created to expand Springfield, whether it be through construction projects or even services and goods provided in our area. They have everything to do with industry and economy in Springfield. That being said, they also support the growth of our business economy. So under various different departments, we have resources funded by the city of Springfield and also supported by the city of Springfield. So one of them can be found on the Small Business Assistant website, which you can see is right here. And not only are there technical assistance programs available, there's also mentorship programs that they have affiliated outside of the city. One of those is SCORE, which is a nonprofit organization dedicated to entrepreneurial education through face-to-face and email counseling. The Massachusetts Small Business Development Center Network's Western Regional Office is the one that provides us services here. And they also do consultation on your business plans and strategic planning and things of that nature. This website will also show you whenever there is any government funded program, grants or loan offerings and things of that nature. So they also connect with you with other greater organizations like Mass Development, who also comes out with grants annually and throughout the year in different quarters. So in regards to finance, I do want to make sure that we're pooling our resources by looking at the resources that we always have existed and not necessarily have access. Sherard, are you in your line of work, are you familiar with grant writing? Do you use it on a regular basis for your business?
So in school, we touched a little bit on grant writing,
Okay.
and I had to do like grant writing proposals and things like that.
Yep.
I have helped some local businesses with, either reading over their grant and editing or helping them like create some of the grant writing.
Yep.
But I feel that one of the biggest things, even for myself, is the fact of not knowing about the resources that are available that you just listed.
Very
Um,
true.
it's not saying that they're not out there, but you don't see them as widely advertised in our communities. Or we feel like we wouldn't qualify because you have to have a certain type of status.
Yeah.
Um, but I did experience one of the workshops through the Small Business Association, and it was a good workshop. And it seemed like they're willing to help, but you have to take the step. They're not going to come looking for you.
Yeah. And it's, to me, that's kind of unfortunate because if the service is, and you would see it, most of them are nonprofits, most of them are community-based services. If you're not looking for us, then what is the job, you know? If you're
Mm-hmm.
creating these programs for the community to access and benefit from, I think there should be a little bit of energy that's used by these organizations to make sure that people are actually accessing the programs. One of the most disheartening aspects about nonprofit organizations is oftentimes grant funding isn't renewed or it runs out because no one uses it. And so they don't have the data to support getting that grant again. And the only people that really lose out is the community who needed that service in the first place. So yeah, that's awesome that
Yeah. And that's why my mentoring program
yeah.
is not gonna be insurance based. It's going to be grant based.
Mm,
Because
that's
insurance, yes, because with a lot of mental health agencies, you lose insurance. I got to stop working with you. But
over.
if it's
And it's
grant based,
so traumatizing when you have
exactly.
to abruptly end that crucial part of um your journey to healing, because we the same energy that we have towards a broken bone or something that's bleeding, we should have towards internal pain and emotional and social pain. And the fact that we don't, we see the consequences. Even if we can't see the pain, we see the consequences every single day, which
Exactly.
complicates every aspect of our reality. And you would think because we know of these different preventative measures that we'd be invested in
Hmm.
creating change, and that's important. And it's exciting that you're providing that resource to the greater community so that there can be a consistency that our traditional insurance policies don't currently allow. And
Exactly.
in our communities, there's so much information that changes in general. So it's
Hmm.
like when one little thing changes and it takes away your policy, it's like it's hard. We're in survival mode. Our address changes all our time. Our household size changes all our time. We're hired. We're not hired anymore.
Hmm.
There's a consistent high intensity stress. So, like you said, it's not made for that type of environment. It's made for a stable, um,
Exactly.
very privileged environment. And I wish
And,
that was where majority of our community is at. But we're just not
and,
there yet.
and even with the small businesses, not even just saying around mental health,
Yep.
but just in general, whether you're health and wellness, or you have a restaurant, or you just have anything, this, like, and you're an entrepreneur and you're individual, it's good to go to these resources and use and see what grants are out there even for your business to sustain.
Mm-hmm.
Because even with this pandemic, a lot of people closed their doors because they weren't able to financially sustain their building
Yep.
or their business. But
Mm-hmm.
if they had known about these resources, would they still be open?
And it's unfortunate that for so many businesses, it's just too late. Like for me, one that breaks my heart, honestly, is Big Mamu's. Like that
Hmm.
restaurant was known across the coast, like more than just this region. And it was something that was an amazing part of our culture. I don't know the story. Did he know that these things existed? How come there wasn't a team of people that say, hey, you're too vital to our culture here. We're going to support you. Like I often think about how much our community can grow to support each other once we get a hold of resources and once we consistently understand where things are, what the needs are, and how quickly we can access these things. Because we're losing out big time. Like we're
Exactly.
definitely being affected.
Yeah, and I feel that that's one of the areas of opportunity for all of us is if we have information, it's okay to share it without looking for something in return. But
That.
I find that a lot of people, not going off our conversation from the other day, because I still stand true to what I said to you the other day. But
Yes.
but so a lot of people will give or will withhold information unless they're going to benefit from helping someone else out. But if we're doing stuff again, it's just another way of helping one another. Because if I help you succeed or improve, then eventually the favor will be returned to me when I'm in need. So
Yep.
it's not, use these resources to build each other up and see each other succeed.
I agree. And on top of that, when we collectively raise our quality of life gets better. You know what I mean? People aren't always going to be watching your pockets because everyone is eating. You know what I mean? We
Mm-hmm.
create a lot of the stresses in between ourselves because we're limiting that access. And a lot of people move up a little in the world and they want to covet that little piece, thinking that there's
Mm-hmm.
this small piece of the pie that if they share it, you're never going to get it. But that's the same mentality that they have against us. So we can't become our oppressors just because we succeed a little bit. I completely believe there is more than enough resources. If we can fund every war on the planet and somehow still manage to have a country, we can figure out how to support ourselves financially through the resources that we have never accessed before. They've been allowed to spend it on whatever they wanted because we're not coming after it like it's ours, you know? So I completely agree. We need access to the resources. We need to share the information with other people. And we need to make sure if there's support needed, we're going to support each other in getting it. Because if we all win, we literally all win. So yeah, well, that was the State of our Union in regards to finances. See, told you it was easy. We just did a whole segment. And this is going to be a great conversation. Okay, moving on. In regards to health, we are going to continue our coverage over spiking COVID rates. And the reason why we're doing that is because it's affecting our household. So I know we still got a lot of controversy against what we feel about COVID, but it's not about personal feelings. It's about statistics. It's about life and death. It's about your family. It's about our family because we're all living in proximity to each other. There's about 155,000 people here, and we all have each other's health in the balance. So with that being said, Trinity Health did an update on the Western Mass region in terms of cases. And I just wanted to share a little bit of information of what they're saying is the cause of the spike in these COVID rates. So I will read. This article states, currently in Massachusetts, there were more than 27,000 new cases reported on January 5th, with a 7-day positivity rate of 22% and more than 2,400 hospitalizations. And I quote, right now, we see high community transmission of COVID-19 across the region and across this nation, said Dr. Syed Hussain, Chief Clinical Officer at Trinity Health New England. Last paragraph, Hussain said that it is a sign that masking and social distancing need to be brought back, at least for the next few weeks. He told Western Mass News that there are more than 200 hospitalizations due to COVID-19 at Trinity Health, and that more than half of those patients are unvaccinated. And so this was reported on by Ryan Trowbridge and Hugh Zetlin and Chris Pisano at Western Mass News. So in terms of it being connected to community transmission as it described in here, I think that's a direct connection to the holidays. I just feel like we're still like Thanksgiving is gone, but we definitely did Christmas and New Year's and Kwanzaa. And unfortunately, there were some consequences. We know that the mandate has come out since January 3rd. So this past Monday in Springfield, we are required to wear masks in all indoor buildings and facilities, regardless if it's private or public. What are your thoughts surrounding it? What's your relationship with COVID right now?
So of course, it's always, safety first. I'm going to use the word secular job.
I like
That's always like the thing to say. Did require all its employees to be vaccinated. But one of the things I would like to say, everyone has their own choice whether to get vaccinated or not get vaccinated.
yeah,
What I'm about to say is not to tell you anybody to get vaccinated, but what I am going to say is do the research for yourself.
yep,
Because there's a lot of people that are listening to, so many people have theories about the vaccine, the reason
yeah,
why it was created, why it was here. My provider, my PCP, my doctor always said, I'm not going to tell you to get vaccinated. You do the research and you decide.
yeah.
I ended up getting vaccinated before the mandate came out for my job
Okay.
because of it. So, and as I was in the grocery store today, the cashier said, my daughter, her husband, and the kids, they're all vaccinated and they got COVID. They weren't supposed to get COVID. COVID was supposed to cure it and you not get it. And that's one of the biggest misconceptions that's
Yeah,
out there.
misinformation.
Just like a lot of the other vaccines we take, it
Yep,
does not prevent you from getting the disease. It's
stops you from
more
dying.
of a way to lower the symptoms. So don't, I just want our people to stop saying, I got vaccinated, but I still got it. You can still get COVID with the
Yep,
vaccine, but your symptoms are supposed to be lower. Yes, certain people have different complications, and you'll hear this person passed, they were vaccinated, but they stopped there. But there's
right.
always more to the story. So my thing is with that, do your own research, stay safe. And if you're still sitting around saying that this isn't real, but yet people close to you are dying, I think you need a reality check.
That's
That's
true.
the
It
only thing
is
I can just
true.
be, because if it's not real and your close friend just died of it, and you hear them saying, they just want to put it on a death certificate. Um, that's not true.
No.
Because even if you go to the Spanish flu of what,
18. Yep.
1919 or whatever, it
1918.
lasted on average, what, 3 years?
Mm-hmm.
And, we're going into our third year now.
Yep.
But if we all don't pay attention and take ownership and do our part in making sure everybody's safe, and yeah, they say wash your hands. Yeah, they say do all this stuff. Yeah, they say sanitize. But if they're telling us to do something to remain safe to stop the spread, then we need to do that. And then
Yep.
it goes into business owners. Yes, I understand you're going to get a financial hit, but you also have to, and
We all
encourage the
have a
people that
role.
come into your businesses. Yes, there's a mask mandate, so I shouldn't be walking into your establishment looking at people just walking in with no mask on and you're not saying anything to them,
Yep.
because now you're a part of the problem.
Exactly. Exactly. And then it doesn't come and get under control. I think what you brought up in terms of the historical perspective is so important. Like, we are the latest humans to exist. We are the last pandemic. Like, there's so many pandemics before us, including, like you said, the Spanish flu, that showcases how pandemics work, especially when they reach a global level, and how it takes a collective effort on a community level, on a business level, on a government level, and the health services, and so many different realms to do their part in keeping us all safe, to navigate the mutations and all the different consequences that follow a pandemic, including a weaker economy. Like, we know business is going to be slow. That's why there's all these forgiveness programs. We know we're going to need more
Mm-hmm.
money. That's why there's grants coming out. So you're right, taking this logic and understanding that we're in a pandemic economy right now. We have to do things that we may not want to do. But if the risk is people dying versus being a little frustrated, I think we can take a frustrated mass over another.
Exactly. I'd rather be frustrated.
I agree. I just want to end with some information on Springfield specifically. This was also reported by Western Mass News, Ryan Trowbridge, and Leon Purvis. So, Springfield, Mass, COVID-19 cases in Springfield for this week so far are nearing 1,500 cases. The data comes as the indoor mask mandate just went into effect this week, and the city has reached a new all-time high in a single day. The previous record in a single day was 561 cases. On Monday, the city saw 688 cases, and the week is not over yet. It's scary. You can be a carrier and not know you are, said Elizabeth Miranda of Springfield. Last paragraph, let's compare this week to the past 2 weeks of cases. For the first week of January, so far, the city of Springfield is at more than 1,400 cases, and that's only in a span of 4 days. That's already more than the 1,100 cases reported the week of December 19th, and almost 900 cases away from reaching the all-time high from last week of more than 2,300 cases. So it's not just going up by a little, like it's spiking. That's the perfect term for it. That means not only is it spreading quickly, but we're playing a part in it. That's actively engaging with people without your mask, going to different functions, being in proximity, or even it could be not telling people when you've been exposed. Or listen, I'm out of sick days, Sherard. I am out of sick days. I know the feeling of wanting to just go into work, but if you are going to be that catalyst that spreads it, you got to chill. You just got to chill. So it's like, it's stressful, and people are taking risks because we know we want to get back to normal, but if we don't make it there alive, what's the point? You know what I mean?
Exactly. But then another thing too about that sick day thing, right? Get to know your company's policy on COVID leave or COVID sick time, because a lot of companies aren't going to tell you about that because it falls within the FMLA guidelines and things like that. So get to know that, because that was one of the conversations we had at work, where you have a set amount of time, you just have to get approved. And we're all paying in that new FMLA policy thing that's out for our leave. So instead of just paying into something that you're never going to use, why not use it? So please get to know it, because job may say you're going to lose your job if you don't come in, but you have COVID and now you're
whole
about to.
time there's a whole protected statue just waiting there. See, that's the resources you need. You are so right. There has to be a COVID policy. And if for those of you who don't know, an FMLA policy is well, it was created to basically cover employed peoples that didn't have necessarily vacation time or time off that they could take through their regular job of employment. So if there's certain medical concerns, pregnancies, things like that, everyone that's United States citizen by federal law has the right to have days off and still have their job. So what we're referencing right now is the fact that there has to be a COVID-19 aspect to that FMLA policy that exists at your job currently. So if you need to take off work, if you're sick or you've been exposed, or you're a caregiver of someone who's been sick or exposed and are directly impacted by COVID-19, there should be a scenario where you'll still be able to maintain your job, maybe work from home or do something else based off of that policy. That was a major key.
Exactly.
That's so true.
Exactly, because even I know some business owners and some local leaders within the religious community where people have tested positive and they're not being truthful to their members, or businesses, and it bugs me. But
Yes.
I just pray people get it together.
Yeah, we have to. And the downside about this is the more we play around, the longer this gets. So we're trying to fake this normal, and we're just prolonging not getting back to a new normal. You know what I mean? We're just literally creating more issues for ourselves. If we want to be outside, we can't be outside until we're inside.
Exactly.
That kind of thing. Okay, awesome. Moving on. In regards to social justice is up next, and we kind of have a two-part based on what happened today, but we're going to start with what was planned, and that is a special segment in remembering political activist Sophia Jeffery. She was a political activist known in Springfield, all over the region, even on the federal level. And so there was a wonderful, okay, go. Sorry, I have my children at home. 1 second.
Sorry. It's okay. And if I look up, that means I'm looking at my computer monitor. So, don't mind me.
I am so sorry for the unprofessionalism, but thank you. So yes, we are going to take a second to watch one of the video clips that one of our local news stations showcase in remembrance of her, and then also just talk about political activism in Springfield in general, and then tie into the breaking news of today. So one moment to share that with you all. Make sure that my sound is also shared. And here we go.
Time now 6:39, and new this morning, Springfield city leaders are paying tribute to a local political activist, Sophia Jeffery, who has died. Jeffery was a member of the Democratic State Committee and is remembered for her commitment to civil rights and access to housing. In a statement sent to 22 News, Mayor Dominic Sarno called Jeffery a community builder who helped create empowering and enhancing opportunities for thousands of individuals and families towards a better life. City Councilor Jesse Letterman said that Jeffery was a great campaigner whose efforts ensured that Springfield got the attention it deserved from the statewide candidates and office holders who sought her counsel and support.
Awesome. So, as a new political podcast and just Springfield members in general, we want to make sure that we're recognizing legends, especially when they leave us. And so Sophia Jeffery was just that. She worked for decades on supporting equitable housing, and she did that in a myriad of ways. One of the things that was so exceptional is not only did she work in the housing field and volunteer in regards to housing, but she became the advisor to many different political officials on both the local, state, and federal levels because of just her knowledge of what was actually occurring in the housing industry in Springfield, Massachusetts. And upon her passing, so there was an outpouring of love from a variety, like a spectrum of people from across the region, just describing how amazing and phenomenal of a woman she was and fought to the very end. And so we just want to thank her, because we wouldn't be able to do things like we're doing if people weren't fighting for decades and decades for equitable justice in a variety of places. Springfield is known as the city of homes, and when that was threatened for Black and Brown people, it's people like Sophia Jeffery that really got right into it in the nitty gritty. It didn't matter how scary, how white, how distant the room was. She entered it and she knocked down some doors for us. So thank you, Sophia Jeffery. With that being said,
And 1 second, because I met her a couple times, but my first time really engaging with her was when I was voted in to be a delegate some years back. And I went to the big convention.
Ooh.
And what I was doing, what I was supposed to be doing. And I just went up to her because I was like, I don't know what I'm supposed to be doing. She was like, well, let me explain it to you. She actually took the time. It wasn't like one of those brush off, well, you better get it together. And
right, yeah.
But, the few times that I did meet her, she was an awesome person to talk to. Always had a smile on her face, even when she was frustrated with people. So, yeah, she would be missed.
Yeah, she's one of those people that has the vision of how things should be, a long time before people see it.
Mm-hmm.
So her frustration was definitely justified. But she acted out of love and concern for our community. And one of the worst parts of our community being in survival mode is housing insecurity. Our homelessness is off the charts. And even for us who do have homes, it's often in very low quality life environments. A lot of trauma. We discuss in education how the remote learning scenario really affected our community differently, because many homes aren't a peaceful place to be. It might not be warm. You might not have access to resources as you would in a school building consistently. So the housing crisis is very real. And we are so grateful for what Sophia Jeffery did for us, and what her legacy is going to continue to inspire. Because like she did for you in those very few moments, she did to many people who are now charged with continuing her legacy. So we definitely are grateful for her.
Exactly.
Okay, so that was going to be our complete segment for social justice today. However, there is a lot going on in the city of Springfield. Without going into too much detail, because it is an ongoing investigation, and I've been on the phone with a variety of stakeholders all day, and there are, let's just say that's the only thing that's being talked about. And that's what I'm comfortable with saying, because there's some conflicting things going on, and we just need evidence to discuss these things in an objective and safe way. That being said, there was a Springfield citizen who was killed this morning, Orlando Taylor, by a Springfield Police Department officer. There was a press conference held by Commissioner Clapperud and Mayor Sarno today, where they described what happened, and they went a step further in saying that they are proud of the officers and that it was a justified or a reasonable response. Now, again, without evidence, we're not even going to go there tonight. We're just not going to do that. But one thing I will say is that we've had a report on the issues of our police department for the last 2 years by one of the highest authoritative figures over the police in the country, which is the Department of Justice on the federal level. That being said, many of the things that the report outlines rightfully creates caution and concern in the Black and Brown community in regards to police relations. That document described a department that used excessive force and systemically abused our constitutional rights, specifically our Fourth Amendment rights, as well as when there was abuses of force, it was not customary to be properly reported. And even if reports did go through, it was covered up from the lowest to the highest of authorities. All that is in a legal document produced off of $1 million investigation into our police department. With that understanding, it's very hard for a community to watch the leader of that department and someone who has pacified that department say that everything's okay and that this was good and this was the best outcome. And so as we navigate the evidence coming out throughout the week, one thing needs to be said. If the DOJ report was handled seriously and there was 2 years of trust building work between the police department, the training, the professional development, the community, right now, in this moment of crisis, the community would have been way more likely to believe our administration and wait and be cautious for the evidence to be portrayed. But right now, in everybody's head is, well, is something being covered up? Are we being lied to? Is this da-da-da-da-da? Because you never changed. You never said that you would. You never committed to even adhering to the recommendations of the report. So here we are in a crisis on a brink of a very, very huge community relation event. I don't know if you want to speak on that, if you want to let that go, but that's just where I'm at with it.
As you were sitting there and you were talking, I was thinking of a training that I went to in Connecticut at UConn, their School of Social Work. This was during my undergrad. And one of the things that they promote is social workers getting involved in every aspect of politics, in every aspect of leadership, because in order for there to be change, they feel it will come from a properly educated social worker that can cover all fields versus someone that doesn't have a social work degree and it's just focused on how they can enhance as an individual versus how can I help the community.
Yeah.
So it's my understanding also within the Springfield Police Department, I believe it was last year or the year before, they were supposed to be implementing social workers to go out with the police or to respond to some of these calls before a police officer. And they were actually hiring or looking for social workers, but I haven't heard of anybody getting hired. I haven't heard of them actually using that process because, you know, going to a training to become culturally sensitive doesn't make you culturally sensitive for sitting in a 3-hour training.
Doesn't.
It's a part of the process. It should be a part of your life. You should be really doing it to really help the community versus putting a badge on saying I'm bigger and better than you are, when in reality you work for the community that you feel that you're bigger and better than. We're the ones for taxpayers, we're paying your bills.
Right, exactly. And that even shifting that mental perspective in the outright police, okay, this is the situation, I need to end it, I need to exude some type of force to control it, versus a person is in crisis, there needs to be an intervention. That's an entirely different perspective. And both brings you through a different path, like a different trajectory based off the decisions on those perspectives. And it's important to recognize that we know our community have high rates of mentally ill people. We know our community have high rates of people who've been to jail, or high recidivism rates, people who might be traumatized with interactions with the police. We know this exists, so it's not going to be an anomaly that you meet in a crisis situation having these issues. It's probably going to be closer to the fact. So why aren't we overly cautious in terms of providing the resources to limit these lethal scenarios? It doesn't make sense that we act like, oh, this was the best case. No, it wasn't. We know what's in our community. We know the pain that we're trying to heal from. We know the trust that is not there, that is also ending our lives. You're not trusting that we need help in this moment. You're trusting that we need to be put down. And we're not trusting that you're helping us. We're trusting that you're probably going to put us down. And so the cycle continues. And the only people who get hurt, that's the biggest problem with this cycle, is the only people who get hurt is the people who are supposed to be protected and served.
Exactly. So, and, you know, for my last part is there's two sides to it right now. Because it's not happening to my family, it's justified.
Yep.
That's what we see in the news, or we see played out in the news. But the minute it happens to their family, something needs to be done immediately.
Oh man, say that.
The other part is a lot of people will say that there needs to be some type of change while waiting for somebody else to do it. If you're able to recognize the change and something needs to be done, yes, someone else may be doing it, but why not join them to help make a bigger impact on the change that needs to be done? We have a lot of people that are sitting around saying, this needs to be changed, or that's the way it is, or saying, yeah, it needs to change, but such and such got it. No, you recognize it, so join them.
Join.
You know,
yes.
So don't just say you need to see change and you're not being a part of the solution.
Yeah, and how we address these situations is a part of the change we need to see. So everyone's like, oh, Tiffany, chill, it just happened. So today when the press release came out, the press conference came out, we were expecting Commissioner Clapper to describe the details of the event, which she did. That's her job. What we weren't expecting was saying that she was proud of the officers or saying that this was justified. You're not the investigative body. You're not the IIU. You're not the DA. So how can you be creating that narrative already? And then with Mayor Sarno coming in and describing how and repeating it over and over, we said, put down the weapon, put down the weapon. But he's creating this imagery of the scenario. And then you're telling the community and the family to wait on the evidence. You can wait on the evidence, but we don't have to wait on the narrative that we're going to create about what happened. So everyone creates their biases. And if things like this, if this gets taken to court or whatever, there's already a narrative 10 steps ahead of the actual evidence because they're in control of it.
Exactly. And we need to push our city council. We need to push our city council because the judge already ruled on what needs to be put back in place in the state of Massachusetts as far as with the whole police department and stuff. And if we don't push them to make sure that this happens, those that we put in leadership roles and stuff like that, and that we voted into office, and then sometimes they're quiet, or even the ones that we vote into office that has always been quiet, but because their name is just familiar, we just vote them into office. We need to be calling in. We need to be knocking on all their doors and stuff because everything is public record. Sending letters to their house, sending letters to their email, basically saying, yes, I know you're saying you're doing the work, but I need to see the work done.
I need to see it. Because listen, I'm telling you, y'all gave me all that mess about my Black Lives Matter mural. Y'all did your own on the street. Y'all had on kente cloth. Like, come on, what's up? You know what I mean? This is the time where you show that you support Black lives. Not when we paint the streets in the summer taking pictures. Exactly. I'm talking about now.
Not all city, there are some city council members that, are pushing it, and then there have been labels attached to them because of them being outspoken. And I don't even know why I want to talk about it. Why is it that when a Black female becomes outspoken, she's bitter and upset and angry, but then me as a Black male, I can say the same exact thing and I won't get something labeled on me? But that's a whole nother topic. But
I'm trying to be here for 2 hours tonight.
I'm trying not to, I promise. But that's what it is. It's like, yes,
that's what Real Recognized Fake does.
You know what I'm saying? We need to really stand behind people and actually push those that are in positions, even the newly elected ones, to actually stand up and say something and not just be quiet. Yes, we're waiting for the evidence or whatever to come out, but it'll be good to have somebody from the city council get on the news and say something.
And yes, we know there was a press release. Yes, that would be amazing.
What we want to see. Exactly.
That would be amazing. It's like there's a disconnect, and they're all talking about it. So it's not that they're not in tune. They're all talking about it. They're all focused on it. But in terms of the people who are always on the outside looking in, it's the community that's getting hurt. Things are happening to us and we can't know about it. How is that supposed to make us feel safe? How is that supposed to make us make proper community-based decisions when you really do feel like, okay, am I next? What's happening is how, when there's such a charged fight or flight energy, how do we not expect people to choose fight more often than not?
Exactly.
I'll end this segment from a paragraph that was found on page 3 of the Department of Justice report. So again, a lot of people told me chill today, but it's like, if y'all read the DOJ report, you would not listen to people who are referenced in the report as if they are some beacon of truth. Our commissioner can't even testify on the federal level because she's been caught falsifying reports. She's a baby cop. So it's like you don't know the depth between the insecurity that we have with the department because you don't read the research, but then you're claiming that people need to calm down. If you were well versed, then you would know that this is a time to turn up. So here's what it says.
One second. That's a big issue. That's the issue. A lot of people don't read, but they want somebody else to interpret what they read for them, and they take that as truth. So if people need to read.
Yeah, they do.
Sorry.
No. You're right. It's true. We have so much information available to us. So the paragraph states, moreover, there is reasonable cause to believe that officers use excessive force even more often than our investigation uncovered. This is a multi-million-dollar investigation that took 2 years. And they're saying that there's reasons to believe that there is more corruption than they even uncovered. Indeed, we identified evidence that officers underreport force that should be documented even under SPD's minimal reporting standards. In many of these cases, the evidence that is available suggests the force used may have caused serious injury and may have exceeded the level of force justified by the circumstances of the incident. So if our federal government is saying this is what the Springfield Police Department does on the regular, why wouldn't we question something when someone died? That's the perfect time to make sure that that wasn't an excessive use of force, you know? And so that is definitely going to be on the topic of everybody minds this week. And we're going to be following it and definitely reporting it right back on live next Sunday. So thank you so much for navigating that with me. I know it was a lot of energy, but it just has to be said. Next up, we're almost done now. We got 2 more segments with you. This has been so much fun. Oh my goodness. Okay.
I know. Here you go. Got talk a lot, Sherard.
Listen, I got you, and it's all meaningful. So just keep bringing all that a lot here. That being said, we are moving on, and I specifically picked this because of your expertise. But we are moving on to the state of our union in regards to the youth. And right now, I want to discuss about a report that actually came out in December. But again, so much is going on that we generally don't pay attention to things like this on the federal level, from the federal level, but I do, so I want to share it with you guys. That being said, here is the title of this report. So the U.S. Surgeon General issues advisory on youth mental health crisis further exposed by COVID-19 pandemic. You briefly touched on this earlier, but in terms of our youth needing mental health services and their access to them, we've been in a crisis for a long time in terms of youth being able to consistently access these services. That being said, the U.S. Surgeon General, which is like the doctor of all doctors in our government, he is saying that the crisis is so much worse. And he's actually charging all of us with helping. So I'm just going to read a couple of the paragraphs just so you guys can get a gist of the information. So the Surgeon General's advisory calls for a swift and coordinated response to this crisis as the nation continues to battle the COVID-19 pandemic. It provides recommendations that individuals, families, community organizations, technology companies, governments, and others can take to improve the mental health of children, adolescents, and young adults. The technology companies is important because we have a lot of data that talks about how Zoom, Facebook, Instagram, all these different technologies are impacting our youth's mental health negatively. It goes on to read, mental health challenges in children, adolescents, and young adults are real and widespread. Even before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide, and rates have increased over the past decade. The COVID-19 pandemic further altered their experience at home, school, and in the community, and the effect on their mental health has been devastating. Let's stop right there for a second. What's your initial reaction to this? Is this similar to what you've seen in your line of work?
I've actually seen this way before the pandemic, though.
Oh, wow.
So it's just nothing new. I feel the pandemic has enhanced it more and has exposed it even more because of we've been in quarantine or isolation. So it's more noticeable, more real, where the parents are able to see it more. And it's not just seen in school. So I feel this has been going on for a while.
Yeah. I completely agree. And honestly, it was probably expounded in our community the most, which is the one that's least paid attention to. We've been crying for these services, and it's not just so for example, when it comes to drugs, right? We call it an opioid crisis now, right? An opioid, I can't even get the words out. An opioid crisis, but in suburbia, because it's in pill form, but when there was a crack epidemic and when there was such a high rates of fathers being arrested and families are broken, like when we're compiling, like, look at what's happening to the kids. Compiling all that data, screaming it from the churches to the schools to the government tops, nobody's listening. And now, because there's a global pandemic and a little more fair-skinned children are also crying,
Mm-hmm.
we got a little attention. But now that we have their attention, it's important to jump on this, because if they're going to start offering mental health resources, it's one thing to say that this crisis exists, but if there's resources being developed to address this, we need to.
Mm-hmm. I agree. And, I am thankful for a lot of the African American focused mental health agencies that have opened
Yep.
here in
Wellness for
the
the culture and all that.
exactly. You have the African, and I always say the last part wrong, the diaspora, or
Yep, diaspora.
yeah, that one, which is on State Street. Then another one that a lot of people don't realize, you also have Cross Point in West Springfield.
Oh,
Yeah, a lot of people don't realize it. So there are a lot of agencies out there, but it's not so much knocking a lot of these big names like your BHN, your CHD, your
yeah,
Gandara, and all
yeah,
them. Yes, they're there, but are they able to really meet the needs of our said community? Because I feel that a lot of people have visions in place within their businesses, but they have forgotten about them.
yeah,
Because once they see the money attached to billing insurance, it becomes more about the money
yeah.
than me helping you. It's more of how long can I keep you sick so I can keep that money coming in versus helping you excel to where you may not need me as much or at all.
Oh my goodness, you are
Because
going for it tonight.
I'm just being honest, and I feel that a lot of people are even afraid to go see a therapist because oftentimes we're told that if you go see a therapist, you're crazy, or all they're
Yep.
going to do is put you on medication. But one thing I can say is know your rights when you go see a therapist.
Yeah.
Just because they want to prescribe you medication, you don't have to take it. You
No.
can say no. Yes, there's a thing called Rogers Order where they can go to court and mandate it, but they have to prove
That you need it. Yeah.
that
You
you
have that
need it.
time.
And a lot of people can't prove it. But what I can say is there's a need for African American men in the mental health community as well. We see a lot of course, I'm not knocking any fair skin, therapists,
Yeah.
because there are a lot that understand our culture or who have educated themselves on wanting to know more about
Yeah.
our culture. And I don't want to knock anybody on that and say that they can't really meet the needs of our community. But if you want to help a community, the best way to know about the community is ask the community that you want to work in.
Mm-hmm. It's very true. And I know we're in the age of intersectionality and everyone loves everyone, which is very true. But I don't think we can ever not say that the Black identity and the Black experience is not a collective experience. It's something that we, with our skin color, especially in the United States, are specifically affected by. So when your traumas interconnect deeply with your racial and cultural identity, I will always advise for you to try to find someone who looks like you to speak with, because there's just certain things you're not going to comprehend unless you lived every day of your life as a Black person. And that's not something that we should be ashamed of saying. There's a lot of white spaces that they can only understand because it was only meant for them to understand. And so the complexities of identity, we shouldn't sell ourselves short. They oftentimes do not have the answer, and you don't want to waste your vulnerability. And that's what it is, because it already takes takes us so much to tap into that part of ourselves. You know what I mean? So you don't want to waste that vulnerability and get a defeatist attitude towards therapy when it's not necessarily because of the process of therapy, but you're not really accessing what you needed to access in this therapeutic
session. Exactly. And it's like, what was I going to say? It's kind of like one of those where you can't take a class on Saturday and then feel on Monday morning you're ready to work with the minority population. It's a process. It's something that you have to learn.
Theory real quick.
And one of the things I would like to charge to those that are in the clinical field is if you feel that you're not making a breakthrough with that person, it's okay to acknowledge it and move them on to somebody else. You are not a failure because you aren't meant to help everybody. You have to figure out what your catch is, and or what your focus is and what you're good at, and try and focus on those areas. Because if you know that you can't help with somebody with PTSD, don't take them on as a client. Try and refer them to somebody that you know is good at PTSD. If you know you're good at helping youth, focus on youth. Don't try and take on an adult, because that's a whole different area. But be okay with saying, I am not the therapist or the clinician for you. Let me get somebody that's going to be more suitable for you to help you.
That is an incredible point. And like you said, guilt-free, right? So this complex that you're a savior of all, no, that's not how that works. Everyone is going to end up developing an expertise that's best suited for a certain audience, and leaning into that versus giving a spectrum of lackluster services. It only does people more harm than good. The right fit, you're right, in mental health, it's so important. Even with your doctor, there's a lot of people that say, oh, I can only be with a woman. Or if you're going to be picky about your physical health, then be picky about your mental health as well, your social services. You have that right.
Exactly. And then just think of all the education that this clinician had to go through just in order to be able to get to the master's level or license. You have people taking care of you in the medical field that only have an associate or a bachelor's degree. And you're allowing them to take care of your health. Some of them never go to master's or doctorate. But yet you have a master's level clinician that had to go to more schooling and go through more hoops just to take care of your mental versus the person that had to take care of your physical.
Yes. Say that.
So,
we got the receipt.
So I'm just being honest.
We talking degrees.
I'm just being honest. It's okay to question the therapist and things like that. But we as clinicians need to be okay with saying, I'm not best suitable for that person.
Yep.
And then just know, if your mental health is more important for that person to have to get a specific degree to handle, and then your health is lesser than, don't you think a lot of your medical conditions that you're going through ties into your mental health? And if you can get your mind right, and you can actually just get your thought process right, then the medical conditions will go away. They always say you can think you're sick, and then eventually your body will respond. And then what are you doing? You're making these doctors and nurses and nurse practitioners, family nurse practitioners, rich because we don't associate it with our thought process.
Referral after referral.
Exactly. So if we work on our mind, everything else will fall into place.
I completely agree. You just dropped the mic on that one. I'm gonna just leave us with some statistics to get your final opinion, because you just ring it true. You just read everybody fulfilled. The clinicians, the participants, the clients, everybody got to do their part, and you got to be honest with yourself what that part is. And then that it is so true in terms of, if we devoted the time and energy it took to have a sound mind, there's such a higher quality of life we could be living, but we act like it's not as important for a variety of reasons. But we're at a place where we can recognize our mind is so important. So the last bit that I'll read is some statistics. So like I said, the U.S. Surgeon General is charging all of us because we do play a role. It's individuals, it's community organizers, it's business owners, it's churches. We all play a role in making sure our youth, the most vulnerable population, has the support they need as this mental health crisis only expands. So it reads, before the COVID-19 pandemic, mental health challenges were the leading cause of disability and poor life outcomes in young people, with up to 1 in 5 children ages 3 to 17 in the US having a mental, emotional, developmental, or behavioral disorder. Additionally, from 2009 to 2019, the share of high school students who reported persistent feelings of sadness or hopelessness increased by 40%. So like you said, it was rising prior to 2020. It was already on the rise. With 19% seriously considering attempting suicide, a 36% increase from 2009 to 2019. And about 16% having made a suicide plan in the prior year, a 44% increase from 2009 to 2019. Between 2007 and 2018, suicide rates among youths ages 10 to 24 in the United States increased by 57%. And early estimates show more than 6,600 suicide deaths among this age group in 2020 alone. So this is extraordinarily serious. We're literally doubling in some of those percentages over the last 10 years. So our mental health isn't getting better. It's getting so much worse. And our youth are clearly feeling the consequences of that as well. What's your overall suggestion for our community in hearing this, all these details about our mental health crisis? What's the next step? What do you want to leave us with?
I feel that, one, I wasn't saying don't go see a doctor yearly or for your physical stuff. You still want to do that.
Yes.
But what I'm saying is, I feel that we need to get back to a sense of community to where the neighbor can also have an impact on your child. And if they see your child doing something wrong, they can speak to your child and say, you shouldn't be doing that. Instead of saying, don't speak to my child that way, I discipline my kid. I would say, yes, mental health is a big component, and go see a therapist. I have a therapist that I meet with every 2 weeks. And I agree. Seeing a therapist is really going to help. And not everyone is out to get you. Not everyone is going to prescribe you medication. You're able to talk to that therapist and tell them things that you wouldn't be able to tell your closest person. Why? Because they don't know you from Adam's apple. And they're not there, and they're not designed to judge. Because in order to get true healing, you have to get to the root cause of any situation instead of suppressing. Because we talk a lot about generational curses. We have generational mental health that's passed down as well. And if our mama, if our grandmother never dealt with their mental health, what do you think your child is going to deal with? So with that being said, everybody should be in therapy to deal with the root cause of whatever you're dealing with, instead of just doing things surface level.
Yes, I love that. I love that. We all have a role in healing our families, and that's who we are as individuals. We collect into our families, and there's just so much, like you said, ancestral history that's passed down. It's not just our looks. It's the way we think, the way we feel, our flaws, our struggles, the way we communicate. So it's so important to really take that on through healing. A lot of our issues can be solved if we started healing as individuals, as families, as lovers, as partners. Like, there's a lot of healing that needs to be experienced, and it does start on the individual level. So go to therapy. You heard it here first. That's what we do in 2022. Go to therapy. Oh man. Okay, and that brings us to our final segment today, which is 36 Court Street. Every week, we are going to be bringing you the breaking news out of 36 Court Street. And this week was not on the mayoral administration, but actually the city council, because our city council president, Marcus Williams, announced the committee's representations for this year. So here's why this is important. The committees are how anything gets to our legislative body. Everything is heard at the committee level first. So depending on the assignments of the counselors, the power and authority is divvied out to who is responsible for what. And so every year it's assigned, and the assignments just came out. So we're here to breaking news, update you on who's on what committee. So first, I'm going to give you City Council President Marcus Williams reasoning for these committee selections. So he states, and this is quoted by Mass Live by Patrick Johnson, and Marcus Williams states that the City Council will take up a robust agenda, I lost my place this year, and subcommittees will play an integral role in providing a platform for city staff and residents to engage in constructive discussion around those issues. So the committees are also supposed to be a pathway for the community to access the legislative government. So you can definitely share your opinions on different policies, different changes that's occurring to our communities through the community access. You can hear the latest news about policies and advisories that's coming out or being argued. And it's just an important part of our legislative body here in Springfield, Massachusetts. And with that being said, here are the assignments of the committees that we have this year. And it also states who is the chair. Now, the chair would be the leader of that committee, and their name is first. So for general government, we have the chair being City Councilor Michael Fenton, and Catering Walsh and Melvin Edwards is also on that committee. In terms of Health and Human Services, it is City Councilman Walsh that is the committee chair, and Justin Hurst and Govan is on that committee. City Councilor Zeta Govan is on that one. In terms of finance, City Councilor Whitfield is the chair. That's super dope. We have a Black woman in charge of the money. That's exciting. One second, please. And she also has Alan and Govan on her team. The Maintenance and Development Committee is Jesse Letterman. He's the chair, which is cool. That's economic development. And he has a very inclusive philosophy. So that's exciting. And Perez is on that team. Oh, excuse me, I misspoke. It is not Jesse Letterman. That's the chair of Planning and Economic Development. That is Melvin Edwards. The Maintenance and Development is Jesse Letterman. So again, Planning and Economic Development is Melvin Edwards with Perez and Letterman. And then the Auditing Committee is Hurst, Allen, and Curran. Public Safety is Victor Davila, who's the chair, Fenton and Whitfield. Intergovernmental State and Federal Relations, Curran is the chair, and that's Sean Curran. Marlo Brown and Perez is on the team. And then lastly, we have Elder Affairs, which is Allen, Brown, and Hurst. Sustainability and Environment, which is Letterman, Brown, and Govan. And then lastly, Civil Rights, which is chaired by Whitfield, but also has Allen and Davila on it. So the reason why we read this off is because we want you guys to get kind of a sense of where our city councilors are going to be working their efforts this year. It's important that we know who and when to hold people accountable. So if we pay attention to who's leading what committees, we will then know who to ask the questions into regards to ARPA funding or health or security. Instead of just calling downtown, we can more specifically call a city council that we know has power on that perspective topic. So that is our note from 36 Court Street. I cannot believe we are done. That was so exciting. Such a wonderful conversation. Thank you so much for being on with us for episode 2. It was amazing having you here.
Thank you. Like I told you before, I'm not used to doing stuff like this. I'm used to being behind the scenes, but thank you for inviting me and for encouraging me and pushing me out of my comfort zone.
Turn up. You couldn't tell. You were perfect. And that's the part of what real recognized Fake wants to do with this podcast. I know there's a bunch of different people that we can talk to that has a variety of titles that we see in front all the time. But I really want the average person to be engaged. And a lot of you guys are already informed and already involved. And your opinion and your thoughts needs to be heard as well. So that's why I want to make sure that I'm pulling people on this podcast to co-host with me on these important topics that reach a different part of the community that we see with people that's always out front.
Exactly. I love it. And one thing that I want to encourage everyone to like really get involved, because a lot of times we're told that we can't do or we're not qualified to do something when we actually have it all within us, or we've done something in the past that a lot of people are trying to hold us to when we've moved on from that. And one of the things is, and I'm actually looking at the quote now because I was just thinking of it, that my spiritual father, C. Sterling David, he said in one of the meetings was, let God be the director of your movie and not your critics.
Say that.
So a lot of times we're operating and moving on just really a snapshot of what took place briefly, and it's preventing us from growing and moving forward. But in reality, we've moved past it. But because we're so focused on other people's opinions of what they feel we should be doing based off of our past. But just know you've moved on, you've healed from it. Allow people to be stuck there, but you move forward and work and do what you are called and designed to do.
Woo! You are preaching. Listen, we are supposed to evolve as people. I tell people, listen, I'm a new person every single day. I take the opportunity to grow and learn and become every single day. Anyone who knew Tiffany in 2009, you don't know me now. If you knew me on January 1st, 2022, you don't know me now, because I change and grow and learn and forgive myself and heal every single day. Don't let nobody keep you in the state of pain that you've overcome. They weren't with you when you overcame. So how are you going to let them take you back there? If they're still there, leave them pretty self there, because you have so much that you have chosen to invest in. You've chosen to push past, and you have to respect yourself for that. If you did the hard work of forgiving yourself and rebuilding and evolving, then you have to protect that energy. You can't let nobody take it out of you. So I completely agree and believe that Renewed Vision Mentoring is going to be a phenomenal success, because you are an exceptional leader and you have just a wonderful insight that we need in our community today. So thank you again. I'm going to keep talking forever if you keep going.
I know. I promise. I know. I'm like you said, it was only supposed to be an hour. Here
I know. I appreciate you so much. So with that, thank you for co-hosting episode 2 of the State of Our Union. We will be back here next week with all the breaking news around Springfield and the Western Mass region that's important in regards to finance, youth, social justice, and as well as our health and our 36 Kirk Street statement. Sorry, my kid is crying. I gotta go be a mama bear. Have a wonderful night, Sherard, and I will connect with you soon.
Likewise, yeah.
Bye.
Bye.